Welcome everybody, and good evening, and happy World Menopause Day as well to everybody. I'm Karen, I'm co-director of Finesse Movement in Maynooth, and I'd like to welcome all the familiar faces that I see, familiar names as well, to tonight's talk. And then those people I have never met before, and those names that I've never come across as well. So you're very welcome too. This is the 5th talk that we've done on all things related to menopause. And today we're talking about, so the theme for World Menopause Day is actually osteoporosis. And Maureen is going to discuss all that with you after I have gone through my own little bit. So I'm going to talk about mental health and perimenopause and menopause. It's something that really isn't discussed that much at the moment, and I think it's hugely important that we get this conversation going, because primarily it's, you know, every woman's mental health to some degree is affected with symptoms, but in the case of somebody who actually does have a mental health diagnosis, it's actually compounded. It is just, it's pretty horrific to have to deal with, to be honest, particularly when you don't know what's going on. So in my case, in 2002, so we're going to a little history lesson on Karen this evening, but it comes into context. So like it actually was saying to Maureen, when I was looking back and just putting all these notes together, I did draw a few similarities and parallels with my diagnosis and with the perimenopause symptoms that I experienced. But in 2002, I was diagnosed with bipolar disorder. I was 27 years of age, and I knew, I mean, I googled what it was, and what it came up was sometimes known as manic depression. And I thought, oh my God, I am not a manic depressive. I was never one of those, and I still am not one of those people that takes to the bed. And I'm not being, you know, facetious about that, and I'm not undermining what bipolar is, but I wasn't that person. I would have low mood for a few hours or maybe a few days, and then I would never have highs either. So I would just, you know, go back to normal Karen. So I was medicated for this. I was put on lithium. I did some work around it in the day hospital in St. Pat's where I was at the time, and then I decided that, you know, it just really didn't fit with me. So I came off the lithium myself, which I wouldn't advise anybody to do, to come off your medication without supervision. But I did come off it myself because I just didn't like my psychiatrist. I just didn't like him at all. So from those years then, I continued to feel, I was on an antidepressant, and I continued to have a lot of difficulty in managing my emotions. You know, that was one thing that I found really, really hard. I would feel very overwhelmed. I would have bouts of, you know, anger and rage, and I wouldn't know where it came from at all. And in 2007, I became pregnant, and it was a little bit of a shock. And I came off my medication because I was like, oh my God, I'm pregnant. I need to come off my medication. I did that, and then I started to feel worse and worse and worse. And in the end, my gynecologist put me in touch with a psychiatrist who worked with prenatal or preterm women. And I was put back on medication. And that was a big decision I had to make, because there wasn't very much research done on women taking, at the time I was taking sertraline. So, you know, it was the studies were very small, and I really had to make a judgment on, was my mental health more important to see this pregnancy through? And I felt that it was. So I was put on a low dose just to kind of hold me and keep me stable. And I went on to have, as my clients would know, I went on to have a beautiful baby girl who is not too much of a baby now. She's 13 years of age, and she's full of sass, and her name is Georgie. So in that time, I also she was 8 weeks old and I broke up the relationship with her father. I was suffering postnatal depression. I was feeling all sorts of horrible things that you would do when you're a single mother to a baby with reflux and colic and all the rest, and you're struggling yourself. So I had great support from my family and my sister, who I am totally indebted to. But she was born in 2008, and in 2009, so coming up to, she was nearly 18, well, she was about 14 months old, that was really the bottom for me. It was the second time I would kind of consider a real bottom for me. I was feeling overwhelmed. I had feelings of emptiness. I had intense sadness. I would cry at the drop of a hat. I felt like totally worthless and that life was hopeless. I felt very alone, very afraid, and very fearful. Then to add to that, I had episodes of paranoia. I was angry and I could get out of control very quickly. I was panicky, and in the end, I was suicidal. So at that point, I felt I needed to reach out and look after my mental health again. So I voluntarily admitted myself to St. Pat's. I saw a different psychiatrist this time, a wonderful woman called Miriam Kennedy. And I spent 10 weeks there as an inpatient, and spent a lot of time in those initial few days with Miriam, just talking, because she had to unpeel the layers. And I was then diagnosed with emotionally unstable personality disorder. So it's a newish term. If I'm sure some of you may have heard of it, and I certainly hadn't heard of it for until I was researching again, but it's otherwise known as borderline personality disorder. So I'm not really into labels. I'm not really into any sort of label. All I felt was when I went back to my room in the hospital and I looked up what that was, and what Miriam had explained to me was the diagnosis, it clicked for me. It just went, oh my God, that is exactly how I feel, and that is exactly what's going on for me. So it made sense. So in that way, then I was able to do something about it. You know, the bipolar diagnosis made no sense to me whatsoever. So I was never going to work with that, but I could work with this. So it causes you to experience intense fluctuating emotions, and they can last anywhere between a few hours or several days, and they're really, really intense. Like you feel that you are, you know, kind of out of that, like experiencing this sort of thing outside of your body, or you're in a parallel universe almost. So after my treatment there, I then went and started with some talk therapy. So I went and saw a psychotherapist, and in that initial consultation, she said we can go down the route of psychotherapy or psychoanalysis, and I asked her to explain what both therapies were. And I felt that psychoanalysis was, would have suited me better. So I started with her, and I had weekly sessions with her, and at some points when I was really bad, I had sessions with her twice a week. And she was amazing. Like, she just felt like this, I don't know, she became like a surrogate aunt or something. That I would go to her room where her office was, and it was just a really, really safe space for me to be in. And it sounds very Woody Allen, you know, like I'm on this long chaise longue and I'm free associating, and she's sitting behind me, and it's the free association is just to literally talk about whatever is on your mind at that time. It could have been anything to do with the traffic that it took so long to get to Dublin. And from that then, you know, you could end up talking about, you know, when you were 6 years of age and, you know, you broke your sister's toy or something like that. So it was like a stream of consciousness, and it was a very, very slow process of putting jigsaw pieces back together. But for me, the slow process at the time worked for me, because she kind of held me in that space. You know, when I would be very like in despair almost, and I would sometimes leave her office bawling my eyes out. But I knew I was okay. I knew everything would be okay. But it was just what she had lifted on that session. So I was with her for 6 years, and like quite a long time. I could actually still be with her for another 6 years. But I kind of felt at that point that I had done as much as I could do with her at the time. She said our work wasn't finished and I could go back at any point, or I could just go to her for what we called tune-ups. And, you know, I know today if I was to pick up the phone, she'd fit me in as, you know, not within a week, but she would fit me in, you know, within a matter of days to go and see her. So a lot of stuff happened in that time. Like in 2010, I was in college doing a master's. I was still a single parent. In that time, I explored my sexuality and I came out as lesbian. Around that time then, I also then decided I wasn't going to continue with the master's because I felt I'm not that academic and I don't want to do a dissertation. So I decided I was going to retrain as a Pilates instructor, something I've always been interested in. And it was just dealing with people and meeting people that really is what I wanted to do. So in that time then I met Eleanor, who is, some people will know, is my wife. She's also the co-director of Finesse Movement. So we have a little family business going on. She's a physical therapist. And yeah, life was fantastic. We got married in 2017, and everything was going along very, very nicely. But around my 40th birthday, which was in 2015, I did start to experience some sort of funny kind of things were happening. Like I would just have these really bad headaches that I've never had migraine before, but it was like a migraine, but it wasn't. So it was right at the front of my head, it would come down around my sinuses. And any of my clients who were with me around that time, I bored to tears about my sinus problems and what antibiotic I was on and whatever else was going on. But in that time, with all these sinus infections, which I would have about 4 or 5 a year, my back condition reappeared and reared its head again. So I had to go and get a procedure done on that. With all the headaches, I went and had 2 brain scans. I also had blurry eyesight. I had sensitivity to noise. So like when I say sensitivity to noise, it could be, I'd be in the kitchen and Eleanor and Georgie would be there and Georgie could be emptying the dishwasher and it would just set me off and I'd have to leave. Like it would put me in such bad form. It was like literally my ears felt as if they were going to bleed. I went and had chest x-rays because of the anxiety that I was feeling, but it was just this tightness in my chest that I was presenting with. I then started to get driving anxiety, which, you know, I wouldn't go and drive anywhere unless I knew the route like the back of my hand. I was getting dizziness, and at one stage I had heart palpitations on a couple of occasions, which, you know, I just couldn't believe that. That was very, very scary for someone who, you know, earns their living out of fitness. So these sort of things came along, and I never really thought what they were. I was just going, oh God, these are just kind of strange. And then 2018, 3 years later, things just kept getting worse and worse. And then the night sweats started and the day sweats started, and it was just getting worse. And with that, my mood would go really low, and then it would dip for a few days. And then I just find that I would like completely and irrationally just snap at somebody, normally Georgie or Eleanor, out of nowhere, you know, and then like obviously really regret it afterwards. So a year went on from there. The symptoms became unbearable. I was taking an inhaler. I was taking a preventative inhaler. I was going to the gym every day of the week. I was training really, really hard because I love going to the gym. But like I was taking an inhaler before I get out of the car so that I wouldn't have shortness of breath. the sweating was continuing profusely, but I just sort of put that down to that's just the way I am. And also, it was summertime around that time. So we went away to France for 3 weeks that year, and I came back, and believe it or not, like when you go to South France, you spend your time on a beach, you think that would be fantastic. I came back worse than I actually went. And at one point, I was listening to a podcast on a walk, and I came and I sat on the beach and I bawled my eyes out, and I thought, I just can't go on with this. I just literally cannot go on like this. And it brought back feelings of this hopelessness and the emptiness and this, I feel worthless, and what is going on with my life, and well, what am I doing with my life, and all this, and just like intense sadness as well. And I thought, okay, took the phone out, and I sent a message to my therapist and just said, I really, really need your help. So when I came back from holidays, I went back to see her again, and I went to see my GP and basically told her what was going on. She was just saying, look, I think you're just suffering from chronic stress, put you back on the antidepressant. Great, you're seeing your therapist, but I think I might be perimenopausal. And she was like, no way, you're too young. And I said, I don't know if I am. These are all sort of symptoms of perimenopause. And she said, oh, look, and I think just to keep me happy, she took some bloods. And I said to her, but you do know I've only had one functioning ovary for, 12 years, 13 years. And she said, no, you're still too young. So bloods came back fine, of course. And my periods were absolutely fine. So that's why she was like, you couldn't be. And continued on just on the medication, going to my therapy, and then lockdown hit. So then I couldn't see the therapist. And then the anxiety just came like with crashing around me, because obviously our business had to close, and then we weren't going to earn any money, and we were going to have to like pay all these bills, and we have to pay our rent, and what are we going to do, and what is anybody going to do? And the only thing that gave me a little bit of comfort was that everybody was in the same position. So I was I had to kind of try and rationalize it that way. But my symptoms really just ramped up. Panic attacks over panic attacks. I became really overwhelmed, and all the emotionally unstable kind of symptoms that I would have experienced back in 2009 came back with an absolute like driving force. I lost all my strength. I couldn't teach a class. Eleanor was teaching all the classes on Zoom. I wasn't sleeping. I had immense brain fog. I couldn't remember one thing that I had to do that day, and I had absolutely no motivation to do anything at all. And okay, it was probably lucky that we were in lockdown, that I didn't have to be somewhere, and I didn't have to actually function in the outside world. But I started Googling all sorts of different things, which is like obviously the worst thing you could do imaginable. I started getting pain in my forearms, and when we were reopened again, I went to see one of the physical therapists and in our place, and I was just like, how could I get a tennis elbow? I'm not doing anything. Like I can't lift a weight. Like I couldn't lift a kilo little small weight and do 10 repetitions. That's how weak I was. So she was needling me, dry needling me, doing all that sort of stuff. Nothing was getting any better. I couldn't even hold any shopping. And then I was talking to my sister about all this. And I was saying how I thought I was perimenopausal, and how I was just feeling really, really bad in myself, and I thought I was having a relapse. And she said, well, Miriam, my previous psychiatrist, she works with my sister. So Miriam saw me as an emergency as well. And when I went to see her, it was just like, oh my God, it was brilliant that day. It was awful, but it was brilliant at the same time, because, I just talked to her about everything, and we had a recap, and I said to her, I think I'm perimenopausal as well. And she said, okay, well, we'll look at that too. And she changed my medication, which would have been better for anxiety. And that really, once it kicked in, it really worked, and it took the panic attacks away. And I met with Maureen then, and meeting Maureen then, it was just like, just a light bulb was going off when we started talking. You know, she confirmed absolutely everything that I was thinking, that I was perimenopausal. I felt heard and supported and understood, and I felt that there was real hope, you know, going forward. And on her advice, I went and made an appointment with a menopause specialist, which I had to wait. That was October, so I had to wait until February to see them. But I started on a day program in Highfield healthcare, so I wasn't an inpatient, I was an outpatient, and I started that in November. So that was daily therapy sessions over Zoom, because we were in lockdown. So there was CBT, there was compassion focused therapy, there was acceptance therapy.
Commitment.
Oh yeah, that's a commitment. Acceptance act, yeah. Acceptance and commitment therapy. And it was just a real functional way of recovering. And I just loved it. Just delved all the way into it. And a lot of it just made a lot of sense for me. And so then in February, I started on HRT. And anyone who is on HRT will know that it's, you know, it's a bit of a process to get a level right. Some people may be very estrogen deficient, some might be more progesterone deficient, but in my case it was definitely estrogen. But also it was testosterone as well, because the testosterone had to do with the brain fog that I was feeling, the low libido, the lack of motivation, and the lack of strength as well. But I couldn't start on that until I was at least 3 months on the estrogen and progesterone. So I started on that in April and gave it a few months, and slowly things were starting to kind of come good, I suppose. You know, in March, myself and Maureen did our first talk on menopause on International Women's Day, so it was the 8th of March. And then just slowly, catchy monkey, everything started to kind of get a little bit better. My strength started to come back. I was able to go back to work when we reopened in June. I also went back to the gym. Really just noticed a huge difference in my energy. The brain fog was gone. Funnily enough, the joint pain was gone. Every week I just started feeling better and better. Psychological symptoms were still there. Now, there was no panic, which was brilliant, but I'm always going to have psychological symptoms now, as it turns out. But I did feel that I was going in the right direction, and there was, you know, huge hope there. And what I realized to keep myself well, both within, you know, my mental health diagnosis, but also within the perimenopause symptoms, was that I really ensure that I get enough sleep, like good quality sleep. I've actually now, I sound like such the old one, but if on a Monday, I have been known most Mondays because I teach in the morning and then I teach in the evening, and I will go for a 45-minute power nap with some whale music or something to put me to sleep. It sounds very strange, but the dog loves the whale music too. So the two of us lie in the bed and we'll have a power nap for 45 minutes, and I feel totally refreshed, and I'm ready again to go and put maximum effort into teaching my classes in the evening time. So exercise is another thing. I mean, when I couldn't exercise and I couldn't get to the gym, I could just barely walk outside in lockdown, my mood was pretty poor. So I need to go to the gym. Anyone that knows me knows I like to weight lift. So that's when I was able to go back to do that. I was delighted with myself. Healthy eating as well for me. You know, just try and manage the amount of sugar that I take in. I do find that, and some of you may find as well, when you're kind of coming to that last week before your period, your motivation is crap, your energy is even worse. and all you crave is carbs and particularly sugar, and that is just the estrogen tanking in your body, and it's looking for just something to kind of keep you going. So I try to keep an eye on that one. I schedule, like anyone, Eleanor just laughs at me and has been laughing at me for the 8.5 years we've been together. But funnily enough, she's got this master planner diary thing going on now. It's like massive, it's A4. And she's like, can we totally committed to this thing? Like, it's like her Bible. And she sits down and she plans out her day. Before that, Eleanor would be just like out of her head. I plan everything down to the last T, like to the last minute. Because I know that if I overplan and I overcommit, I get overwhelmed, and then I do nothing, and then I procrastinate, and then, you know, something that could be very important gets pushed to the very last minute, and then I panic because that thing has to be done in the very last minute. So I try just to structure my day and schedule, you know, schedule exercise, schedule some time outside, and then I put down 3 things, only 3, that have to be done, and one of them is the most important, and that one thing gets done in the morning when I've got the most energy. And then when I'm well, when I'm really well, I would say that I'm great fun to be around. I try to stay connected with family and friends. When I'm not so well, that's when I go quiet, and you mightn't hear from me for, Gemma, you're there, for months on end, even though I know you live down the road, but we are going to change that. And then something new I've experienced, I find it very hard to relax. So I, you know, as much as when I was on the day program here and there was mindfulness and meditation and all that wonderful stuff, that is a work in progress for me, and it may take 10 years to actually be able to practice it. So something mindful in movement, something like yoga or something like a Pilates class where I don't have to be, I can be taught and I can just tune in with my own body, is something that relaxes me. But something else that I found that is actually helping with my perimenopause symptoms, particularly the flushing, is acupuncture, actually. I wouldn't have really given that any sort of thought before, but I've had some acupuncture sessions and I actually think it's great. So even though I have a mental illness that I know there is no cure for, and I'm going to be heading into menopause, so I'm in the height of the perimenopause at the moment. I know once I stick to these lifestyle pieces that it just keeps me on the straight and narrow, and I don't find myself getting into trouble. So I would say, to sum up the past year in this kind of journey that I'm currently on, I've managed to work on my mental health successfully. I've done a lot of work on it. I've done a lot of reading around it. Done a lot of reading around all the perimenopause symptoms and menopause, and I bought books after books, and, you know, done the talks, and also my general health. I've managed with Eleanor to keep a business afloat despite a pandemic. We're back in the thick of it now, and it's great to see so many clients here with me today. Classes are bursting at the seams, which is fantastic. Myself and Maureen, have also educated and empowered other women on, you know, on their menopause and perimenopause symptoms through our talks that we've been doing on Zoom. I've got back to training in the gym, my happy place, where I've gone from not being able to lift a 1 kilo weight this time last year to deadlifting 120 kilos off the floor last week. So that is, I was pretty proud of that. So myself and Eleanor are in the middle of selling our house and buying our forever home, which we're hopefully going to move into the middle of next month. I've been, along with Eleanor and her dad, we've been able to send Georgie to boarding school. Now that sounds, when I wrote that down, I thought, God, everyone's going to go, God, they sent her to boarding school. But actually, she wanted to go. She wanted to go to boarding school. So she started boarding school in September, and she's doing really well, and she's really enjoying it. So I decided, well, Georgie's not going to be around Monday to Friday. What will I do with all this spare time that I have when I'm not teaching? So I now started doing a holistic life coaching course. So I will be a holistic life coach in the next few months. What else have I done? Today I've become a peer support volunteer with Highfield Healthcare, and I received my pin today that I proudly wear. So I really look forward to working with some people here, just to talk about, you know, how they're navigating their lives through mental health. You know, just giving them support through my own experiences. And then the final thing is I've managed to stay married, which is an absolute miracle between all that. I mean, I think Eleanor was either, you know, she's just very thick-skinned. But yeah, so it's been a very, very busy year. It's been a very productive year. It's been hugely, hugely challenging, but I do feel proud. When I wrote that down, I do feel proud of what has been achieved in the last year. So I guess for me, the takeaways that I would give ye for this evening, myself and Maureen, and I see Deborah's there as well, that I know of anyway. Deborah and I and Maureen, we were on a menopause conference on Saturday, which was ran by the Irish Menopause Facebook group and also the Menopause Hub, their specialist clinic in Dublin. And one of their speakers, she was brilliant. She was absolutely fantastic. She talked about menopause, and I just took this away as my takeaway from this, as a hormone deficiency, and it's basically puberty in reverse. When you think about it, and we're essentially, what's happening is we're outliving our ovaries. So, in that sense, what makes real sense to me is, well, if we're outliving our ovaries, then, and you have a low deficiency in your thyroid hormone, you take a thyroxine or whatever to replenish that. If you become diabetic, your insulin's low, so you need to be insulin dependent. You're losing your hormones. So there's nothing to say why shouldn't you replace them. 100 years ago, the average age of menopause was 47 and the life expectancy was 49. Nowadays, the average age of menopause is 51 and women are living well into their 90s. So I will ask you, how do you want to spend the next 40 years of your life? Is it getting multiple joints replaced because your bone health is decreasing? Or is it, you know, taking blood pressure medication and, you know, getting cardiovascular disease? Or is it that you want to lose your mind and end up with dementia? You know, I know that sounds really harsh, but it is reality, and the studies are there and have shown that this is a consequence of losing your hormones. So now is the time that you reclaim your power. Menopause is quite the topic at the moment, isn't it? So I would urge everybody just to educate yourself on HRT so that you yourself feel empowered and have the knowledge that when you do go to your GP, who don't have any specialist knowledge, majority are getting trained on it now, but when they don't and they start asking you, you know, where are you getting this information from, you bring the nice guidelines with you. Maureen will talk about the Balance app. You've put in all your symptoms, you've tracked them, you're able to print it out and show them what you're experiencing, and you just ask for what you need. You need your hormones replaced. There is a phenomenon that I've read about, which is called the sandwich generation, which is, you know, women have never been busier in their lives. They're holding down senior board roles in multinationals. They're, you know, working crazy hours. They're moms. They're also taxi drivers. They're also then looking after families who are, you know, their own parents who may be sick and, you know, in need of care. And nowhere on that is time for themselves. And I think really we need to get back to putting ourselves on the top of the to-do list and making ourselves a priority. The one thing I will say to you as well, and if you don't follow her, look her up, and you're on Instagram, or she's probably on Facebook as well, but Diane Dansbrook is based in the UK, and she is a psychotherapist, and she frequently speaks about if you have suffered from previous psychological trauma. So that could be anything from postnatal depression to any other trauma, you know, post what is it, PTSD, like myself, I have stuff going on. If you didn't deal with that at the time, or make some effort to deal with it, it will come back to visit you, and it'll come back and bite you. And it did for me, for sure. To the point, like, I just didn't know who I was. You know, thought I was going absolutely crazy. And then the other most important thing is just to be compassionate to yourself. Give yourself, don't be so hard on yourself. Like, this is a really, really hard, challenging time when you're starting to lose hormones. And if it's a point where, so that's where I've learned how to be compassionate to myself. If I do feel wrecked after teaching classes and I've been up since 6 a.m. and I'm going to be going back out to work till 10 o'clock, I will go and take that 45-minute power nap. I won't feel guilty about it, because I know I'll be able to be a better person and function an awful lot better. You know, if you don't want to cook a dinner for your family, well, you know, they can boil eggs, they can make omelets, you know, go buy some pizza bases and tomato sauce and put some cheese on it and make a pizza. You know, just give yourself some time. And with that, I am going to say that I am finished. So thank you for listening. I hope I didn't go on for too long, but I hope you got something out of this that, you know, would resonate with you, that it's, you know, you don't feel that you're on your own, that, you know, things will get better, that it's not forever. And I am going to hand you over to Maureen in a minute. I'm going to tell you what Maureen is all about, for those that don't know her, because she is an absolutely incredible woman.
Just like you, Karen. Not as good as you.
So I'm going to actually read out the list of, when you say that education is power and every day is a school day, meet Maureen O'Dwyer here, who just continues just to keep, you know, educating herself all the time on everything. So she is a graduate of the University of Ulster and is a registered mental health nurse. She's also certified exercise, nutrition and personal training practitioner. So that's a course we were going to get on. She's qualified in both yoga and stop Pilates, which is the school of Pilates that I have also trained in. And she's a certified executive life coach. I mean, it's just amazing. And then she's currently working towards her accreditation as an interpersonal psychotherapist. She has special interest, obviously, in women's health, and has completed a training program with the British Menopause Society, which is specifically designed for nurses, advising women on symptoms and treatments for perimenopause and postmenopause. She's also lived in the UAE with her family, her 2 sons and her husband. And now works in Highfield here, and Highfield are absolutely blessed to have her. So she facilitates individual and group therapy sessions in anxiety management and the management of mood disorders. And tonight she's going to talk to you all about osteoporosis and menopause and perimenopause. So I'm going to hand you over to her now.
Wow, thank you, Karen.
Thank you.
Hi, everybody. I won't keep you for too long. Wasn't Karen just amazing? Karen did this. We have lunch and learns every Friday and continual professional development for the doctors, nurses, and all the AHPs. Karen gave this talk on Friday. It was just phenomenal. The feedback was amazing. There were people coming up to me afterwards because Karen was on Zoom just going, wow. And of course, Miriam Kennedy was just, Miriam's amazing. So thank you so much, Karen, because it takes so much courage to tell your story, but so inspiring as well. And unfortunately, you hear it all too often. I certainly do in the space I'm in. So that's what really motivates me. And it's my passion to ensure that women, myself and Karen, are passionate that women get evidence-based information. And then, you know, you make your own decisions then, along with your hopefully knowledgeable healthcare provider. So I'm just going to run through osteoporosis. It's not going to be too, oh yeah, we're okay for time.
Oh, yeah.
It's not going to be too long. So I'm just going to share my screen here. So hopefully everybody can see that. Oh, look, it's right at the end. Thank you. Hang on. Whoops. Bing. Unlike Karen was saying that everything is planned and done. I actually had a very busy weekend, so I ended up doing this. Oh, look, it's backwards again. Hang on a minute. I'll just run through it. So, oh, look, all the information is going to be here. It may not be very glamorous, but it's all there. So that's the
It's
main
fabulous.
thing.
So,
yeah.
as always.
So today, as you know, is World Menopause Day. When I came into work this morning, they were all saying it must be like Christmas Day for me, and it was all day long, even to the men and everything. I had tremendous fun. So even the young people were telling me all about their mothers with their hot flushes and their anxiety and their roaring and shouting. So we had tremendous fun today. It was great. Also, Wednesday is World Osteoporosis Day. So that's why osteoporosis is the theme for today, for this World Menopause Day. Here's my little disclaimer, because I'm just a lowly nurse, that's all I am. And this presentation is for general information purposes only. And the objective, like I say, is to educate and signpost to relevant services and treatments. It's not a clinical assessment, so please go to your relevant healthcare provider. So where I get most of my information is from the British Menopause Society, the International Menopause Society, and Dr. Louise Newson, the menopause doctor in the UK. She's fabulous. So this is her app, Balance, which you can download onto your phone. It's updated all the time. And her website, it used to be menopausedoctor.co.uk, and now it's this weekend, I think it transferred over to Balance Menopause. It's got all the non-biased evidence-based information on it. So you can't go wrong if you go there. So osteoporosis. Just take a little drink. I'm sure you've all heard of it, everybody knows. My little picture got cut off there. But osteoporosis basically means porous bone. It's a disease that thins and weakens the bones. And
Maureen, sorry, can I just jump in there for a little second?
Sheila.
This is Sheila. How are you? It doesn't seem to be coming up on my screen.
oh, can everybody else see it? Is it just you?
I don't know. It's coming up. Just the thank you screen is on at the moment.
Oh, right. Hang on.
You know the way the slideshow isn't moving through.
All right. Hang on a minute.
Yeah.
I'm going to stop the share again.
Yeah.
And we'll start from the beginning. Hang on a minute. Thanks, Sheila. Oh, there's a few people saying they can't see. Hang on a minute now. Share screen. Oh, the joys of Zooming. Today was our first time getting people into the day hospital. Hang on, exit full screen. Just a minute, I'm going to shut down PowerPoint here. Here. Okay, sorry. Oh, the computer. If you like, you can chat among yourselves. Oh, come on. What's it doing now? Sorry, the computer is just taking a bit of time.
I'll go slow.
It's on a go slow. Don't worry. It's frozen. Just a minute. It is making noises. Hang on. Oh no. Why does this always happen? Maybe if you need to go to the toilet.
Take a little pause, go get some water. We should be hydrating. Go get some
Make
water.
a cup of tea.
Yes.
Sheila, would you like to give a little chat? Would you like to talk about?
Have you got any questions for me?
Oh, there we go. We could even ask Karen questions. I would just like to say, Karen, I'd love to jump in to say thank you so much on, today, World Menopause Day. It was really inspiring to hear your story. And I feel even just sitting here with a group of women this evening, it just feels like, we're all coming together to kind of support each other on our journey.
Yeah. Thanks, Sheila. Yeah, it does kind of have that sort of sense. That's why, it's like telling your story. And actually, this is the first time I've actually, pretty much told this story, but in its entirety. But yeah, it feels safe to me to do it. And it feels that, that somebody may just take something out of it that will be worthwhile to them, So yeah, thank you for that.
Very brave in that sense of giving us all a little bit more courage.
Yeah, and it's just, and it's that piece that you said as well, that, we're all experiencing pretty much similar kind of stuff at the moment that's going on, and that you feel that you can be supported and that you're just not alone. Because I remember saying this to Eleanor when I was having one of my small meltdowns, and I was just bawling my eyes out, and I was going, because she is 4 years younger than me, so she keeps saying, and I just said, it's just really lonely. Like, as much as I'm telling her and she knows what's going on, it's still a very lonely journey to go on by yourself,
Yeah.
And I hope for everybody that's on tonight, that you do share this with your partners, because it's tough. It really is tough. And they, nobody's in your body, so they don't know what's going on for you at all.
Yes, you have.
Yeah, yeah.
Can you see that now, Sheila?
Yes, I can see it perfectly now, Maureen. Thank
thank
you.
you, Sheila.
And Maureen, it was lovely to see that it didn't work for you sometimes, because you always have it so perfectly and fabulously. So,
well, I have to say, Sheila, that I had IT over here at 4:00 this afternoon because the computer wasn't working. So It's still not me. I'm perfect.
it wasn't you. You're still perfect, Maureen. Fabulous.
I will be chatting to IT in the morning. They sabotaged me. So, blah, blah, you heard all that, didn't you? My disclaimer, the balance app, and then we were on what's osteoporosis. It occurs when bones lose minerals such as calcium more quickly than the body can replace. It's detectable, preventable, and treatable. And osteopenia, as some of you might have
Sorry,
heard.
Maureen, it's still not running through the slides. It's on the first slide.
Really?
Yeah, there we go. Oh, now it is. Now it is. Yes, it's coming.
Oh, great.
There we go.
Sheila, you're my moderator. You
Sorry.
my
Yeah, no,
goodness.
there we go. It has what is osteoporosis now. Yeah.
Yay. It's just, you see, it's not me. I'm just too quick. I'm too bright.
Yes.
Osteopenia, as some people might have heard if you'd gone for DEXA scans, is the precursor of osteoporosis and is where the mineral content of the bones is reduced. It's kind of pre-osteoporosis, and there's still tons of preventative stuff that can be done. So what are bones? Just a little bit about, so you know what bones are. Bones are living tissue with own blood supply with cells which help grow and repair themselves. And there's two parts to the bones. There's the hard bit that you can actually feel, and the spunny inner network. So if there's some scientists on, you'll know all about that. Then the bone is also composed of living cells such as osteoblasts, which form new bone, and osteoclasts, which remove old bone. And this is where estrogen is hugely important for females, because it helps with the formation of the new bone and it helps remove the old bone. So as you guess, when you have the reduction in estrogen, the old bone, there's not enough new bone being formed, and the old bone, the osteoclasts go into overdrive. So the bone is being taken away, but not enough new made. So there's tough elastic fibers along with other proteins. And then we all know the mineral salts, calcium and phosphate deposited with the collagen. Like I'm always telling my boys, stop drinking Coke because it reduces the phosphate in your bones. Of course, they don't listen to me. So bone strength and growth. So a healthy bone looks like a crunchy, that looks quite delicious. And our bone, 60% of our bone is formed by the age of 18. And then we reach maximum bone on average at about age 30. So then bone formation is stimulated by mechanical force and especially weight-bearing exercise, walking, running, dancing, Pilates, and yoga. And then the more bone that's formed when young, the longer the time before osteoporosis develops. So that's why it's really essential to be active when you're young and create those habits throughout your lifetime. So bone loss, so it looks like an arrow because you've got bigger holes. So what happens is the outside of the bone becomes very brittle and then the inside as well loses that spongy bit. So bone loss occurs with age at different sites and at different rates, but most evident at hips and spine. So that's why when you have a DEXA scan, it's done hips and spine. Your wrist and your elbow are also sites of fragility fractures. With normal life expectancy, women lose 40 to 50% of their bone mass. That's in the normal mid-80s life expectancy these days. And men lose 30 to 40 because they do experience a drop in testosterone. But men, it's a gradual decline. Women, we fall off a cliff at around 50. Rapid bone loss in females happens in the 10 years around and post-menopause. It can be as much as 2 to 30%, 2 to 3% per year. The worst years are the year before menopause and the 2 years after. That's when the acceleration is at its highest. So it's quite a lot. 300,000, this is from the Irish Osteoporosis Society. So these numbers, like, because osteoporosis is a silent disease, I think you could probably triple this number or quadruple it even. 300,000 people in Ireland have osteoporosis, with numbers increasing due to more sedentary lifestyles, inadequate dietary intake of calcium, vitamin D. So I dread to think with COVID and all the working from home and the sedentary life at the moment, that it's going to be a lot worse. 1 in 5 men, so that's 20% of men, and 1 in 2 women, 50% of women, over 50 years will have a fracture due to osteoporosis. And this is the real key one. 90% of fractured hips are due to osteoporosis, with only 30% of people over 60 years becoming independent again following a fracture of hip. And we all know people who've had the hip fractures and the operations. The cost of 3,000 fractured hips in 2016 was 35 million euros. That's a huge burden on the health service. In the UK, it's actually 2.6 billion pounds.
My God.
There are high morbidity, mortality, and economic costs worldwide due to osteoporosis, and the incidence is rising due to the increased life expectancy and the sedentary. You know, our bodies are not designed to live this long. You know, nature hasn't designed us to live till our 80s and 90s, but fortunately, good nutrition, exercise, medication has helped us, and vaccines and disease management. So who's at risk? Well, women, men and women, women more than men, as we said. 1 in 4 comes from the Irish Osteoporosis Society, the Royal Osteoporosis Society in the UK say 1 in 5 men. Women who have menopause before age 45, and remember that 1 in 100 women will have an early menopause, and that's rising all the time because of different, our diet, our sedentary life, the contraceptive pill, and the toxins that are in our environment. Lower estrogen levels account for 2/3 of bone loss during the 5 to 7 years around menopause, up to 10 years. So it can be up to 30% in 10 years. There's a strong family history of osteoporosis, so 70 to 80% genetic. The remainder depends on lifestyle choices, other diseases, and medications. For me, it's in my family, so that's why I've been doing weight training since I was 19, and continue to do so. It's one of my main motivations for going to the gym. Lack of exercise, so like we say, your bone isn't stimulated, so therefore you're not going to have the osteoblasts producing the new bone as quick. Poor diet, inadequate intake of calcium and vitamin D, we know that, and inadequate exposure to sunlight, lack of vitamin D, which especially we all missed our lovely holidays to Lanzarote because of COVID. So heavy smoking reduces estrogen and progesterone, which can weaken bones, and the direct toxic effects of nicotine on the bone. Heavy alcohol, which is greater than 4 units a day. So that's, for some people, that's just a large glass of wine a day. It's really only 2 proper glasses of wine a day. And also, if you've had a few drinks, the risk of falls and fractures increases. High caffeine intake, because that increases the calcium excretion by the kidneys. Other medical conditions, such as inflammatory arthritis, bowel disease, because it's really, really important that your digestive system is in good nick so that you're absorbing the calcium and the vitamin D. So it's really important. So people with Crohn's disease, celiac disease as well would be very high risk. That was another thing. I had celiac disease when I was younger, so I'm very high risk for osteoporosis as well. Medications such as steroids and chemotherapy. Osteoporosis detection then. It really is the silent epidemic, as it's not detected until after a fragility fracture due to a minor fall or bump. You'll often find, for instance, my auntie Maureen coughed and she fractured one of her vertebrae. She also one time just literally banged her arm off the table and broke her wrist. So a fall by an adult from standing should not cause a fracture. So there's called a fracture risk assessment, which you can do with your GP, FRAX, and that also takes your T-score from the DEXA scan. So it looks at all your lifestyle and were you previous smoker, current smoker, all the things like that. Another way is if your clothes don't start to fit because you're starting to bend over a little bit. Maybe you can't reach the cupboards in the kitchen. That's me now. Imagine what I'm going to be like when I'm 70. You're starting to bend over more. And then with spinal fractures, you have unexplained back pain and muscle spasms. That quite often is misdiagnosed as discs or arthritis, things like that. Height loss, again, I'm only 5'1", so I can't afford to lose any height. A curved spine or change in posture. So you can see how osteoporosis terrifies me. So a DEXA scan, I'm sure some of you there have a DEXA scan. I'm getting one next month. So it's totally painless. You're not covered over. It's not like an MRI. And it just measures the bone density of the 2 sides, the spine and hip, because they're the 2 areas that first people start to notice the osteoporosis. And then if you get the FRAX as well, and then you can see where you are. Are you pre-osteoporosis, pre-osteopenia, where are you? And then you can make your own treatment plan from there with your healthcare provider. So there's prevention and treatment of osteoporosis are similar. So obviously the calcium and vitamin D supplementation where dietary intake is insufficient. Really, if you're having a good diet, and the diet, the healthy eating that is recommended by all and by Harvard School as well is the Mediterranean diet. And we all know that one because you've got all the fish, the veg, the nuts, all those kind of things. So you should have enough in your diet with calcium. Vitamin D, no, not because of where we live, and especially in wintertime. And it's really important. So I really make sure all of us now, husband and 2 boys and myself, we all take vitamin D in wintertime. And so they're probably some of the brand names for calcium, and that's the vitamin D. And there's examples of the vitamin D that we all know. And then the milk is fortified these days with vitamin D as well. I think the butters. So then if you don't have enough calcium in diet, you look at that poor fella there. And then, of course, here are all the nice foods. They look delicious. Oily fish are fantastic because of the bones and the calcium bit in that. So you can get it obviously from the dairy and from all the vegetables and nuts. And if you're vegan, because I know there's an awful lot of people vegan these days, you can still get all your calcium. You just have to work much harder at it and make sure you take your vitamin D. And sometimes you have to take the vitamin B12 as well. So just make sure that you really
tell her to empty her bin upstairs in her bedroom.
I'll just quiet. Where is that? Oops. I was just muting there. So exercise. So bones get stronger as we use them. So weight bearing is really important. So weight bearing is basically standing. So even if you're working at home, try as much as you can to stand. Like when I'm here doing groups, I try and stand as much as I can when it's appropriate. When I'm on the phone in the office, I try to stand. If I have to go down, say to, I have to drop something down to Alex, my line manager, she's down, the corridor away from me, I'll walk rather than drop. Just all those little things, getting off the bus a little bit earlier. So even just standing, holding your own weight is really good. Impact is movement and pressure on joints, example, walking, tennis, jogging, and those kind of things where you're going to put some pressure onto your joints. And then the muscle strengthening is really, really important, because what we lose muscle as we get older as well, and we can lose up to 8 to 10% per decade. So it's called, when we lose the muscle, it's called sarcopenia. So it's really, really important to do the muscle strengthening as well. And like the reformer Pilates that Karen teaches, you don't have to go to the gym and do mad HIIT classes. Even just doing your own press-ups against the wall, things like that, really, really important. You'll see there on the Osteoporosis Foundation, there's a brilliant calcium calculator. So you can put in how much you're eating a day. It'll tell you the calcium recommendations, and it also tells you the food with calcium in it as well. So it's a really helpful little tool. So hormone therapy, it's one of my main motivations as well. I always knew I was going to take HRT because especially the protection for the bones with the estrogen. So HRT has a significant role in the prevention and treatment of osteoporosis, but long-term use is required. So my Auntie Maureen, who I mentioned there earlier, who coughed and broke the vertebrae in her back, who broke her wrist. My Auntie Maureen was on HRT and doing brilliant and walked everywhere, did yoga, and look, I look like her, same size as her and everything, and very healthy. She did smoke, but she gave up, drank moderately. So she was taken off the HRT when it came to the Women's Health Initiative, that study where it was the hoo-ha about HRT and breast cancer, which was wildly blown out of proportion. So my Auntie Maureen naturally fell off a cliff then with her bones. She died in 2018, aged 82, racked in pain. So there's no way that's happening to me. Estrogen is prescribed systemically for women who do not have a uterus, and it can be locally in doses for any woman with vaginal symptoms. And then estrogen and progesterone is added to protect a woman with a uterus against endometrial cancer, which can be caused by estrogen alone. So if you take the utrogestin, which is micronized progesterone, it's the only body identical progesterone, that actually protects bones as well. Progesterone don't, they're the synthetic progesterones that would be in the tablets or in the Mirena coil. They have no effect on the bones. And then bioidentical hormone therapy, they're chemically made, they're unapproved, untested from compounding pharmacies, and they're not prescribed by menopause specialists and GPs because they're unregulated. So be careful. Now, there's really good information on the Royal Osteoporosis website about hormone replacement therapy and osteoporosis. Testosterone is a hugely important female hormone. Certainly, I know Karen and I, we both say testosterone was the game changer for us. Testosterone, oftentimes women will take the estrogen, and that's brilliant for managing the skin and the eyes and the urinary, the whole genital urinary part, preventing the UTIs, all the little bits and bobs, the heart palpitations, those kind of things. The testosterone then is brilliant for the sort of motivation to get up and go, the energy, the stamina. It's also super duper for muscle and bone strength as well, and really good for the brain fog piece. So healthy premenopausal women produce 3 to 4 times the amount of estrogen from the ovaries. So it's a hugely important hormone for us, and it's just been taken over, I don't know, by Charles Atlas or whatever, the whole testosterone for men. And loss of testosterone is particularly profound with surgical, medical, and premature menopause. The decrease can be just 50%, and that's why women will just feel like flat, just completely no energy, nothing like that. A lot of women are very, afraid of testosterone because of their marketing. They're afraid they might end up looking like this, but I can guarantee you, Karen, and I don't look like this. Or some women actually think they might end up looking like this, but we won't for sure. So it's really, really important. There's other drug treatments then for osteoporosis that can slow down the breakdown of the bone. They're anti-resortive drugs and anabolic. You might know them, they're called biphosphonates. There's also injections as well. These are not without their side effects, and current research is saying that they're quite hard on the body, so you need to have holidays, every 2 to 5 years, take a break from these drugs. So there's more information. There's the list of the drugs there. And they're all on the Royal Osteoporosis website as well, if you want to get more information. It's a really, really good website, that. So I suppose the take-home message is, it's never too late to change lifestyle factors that can help prevent or slow down osteoporosis. Even if you have a diagnosis of osteoporosis, there's loads of things to do, loads of exercise, and loads of resources if you stay with the evidence-based resources that I've mentioned here. Review your risk factors and talk to your GP. Consider replacing and balancing your hormones if you want to, and you can. Most women can and do safely take HRT. There's a small proportion of women because they have estrogen receptor cancer can't. But again, even women like that will balance risk benefit. It's always worthwhile going to a menopause specialist as well. Keep educating yourself and advocate for your own health and well-being. And I suppose that's what Karen and I are so passionate about, is, giving out the information so that you can advocate for your own health and well-being. Somebody else is not telling you what you can and can't do. So here are all the resources. On Louise Newson's website, there's a fantastic booklet, Lifestyle for Healthy Bones, all about diet, exercise, hormones, treatments, everything. Then we have the Royal Osteoporosis Society, the Irish Osteoporosis Society, and the Osteoporosis Foundation. And then if any of you want to quickly take my email down here now, anybody who's not on Karen's list, I can email you this presentation. I can email you the Healthy Bones booklet as well, if you want, and any other information you want. So that's O'Dwyer at highfieldhealthcare.ie. And there we go. Thank you very much. So despite the little glitch, yay, all done. Brilliant. So thank you all very much for your time and patience, and especially giving your time tonight here on Menopause Day. I'm going to slip in there, Karen.
Just looking to see if there's any.
So has anybody any questions or anything they would like to even put in the chat?
Thank you everyone for all your kind comments. I really appreciate them.
Can I just say that this is my first time. I'm just being put off at the moment because for some reason I'm the main person on the screen here, which is a bit off-putting looking at myself. But, two things. First of all, Karen's talk, just absolutely amazing, inspirational, everything. And I just wish her so well. Your talk was so good. Briefly, my experience, and this is the first time that I've ever really heard that there is a link between menopause and mental health problems. My story is that I started the menopause at 37, and a bit like Karen, I was kind of thinking I had no family history of it. I was healthy, I was active, and so on. But anyway, yes, it happened. My ovaries had packed in at that stage, but thankfully I'd had my children. So I had to go off and have a DEXA scan, and discovered that I was severely osteopenic at that stage. And as you said, sorry, I can't think of your first name, the brain fog. As you said, like that, you know, I had no pain, but when I had the DEXA scan, so I was severely osteopenic, and I was only 37. And so I went on HRT for my bones. And I have to say, it was the best thing ever. Now, as Karen said, it did take a few to get it right. But I stayed on it. My bones continued to improve. I mean, I was practically down in the osteoporotic level. My bones continue to improve. I'm 61 now. My last scan, my bones were perfect. Unfortunately, I spent 15 years on the HRT. Unfortunately, I had to come off it because I had postmenopausal bleeding, and otherwise I would stay on it because it was just so great. And I don't have any family history of breast cancer or anything like that. The other thing is, about around that time, I started to feel just not right. I was normally a very even-tempered person. I was feeling down. I was feeling, you know, looking back, I would associate my depression started when I became menopausal. And I also, around the same time, discovered I had an underactive thyroid. And I would always, like, even though it was never acknowledged really by anybody, but I would have always linked the two of them. Up until then, I was fine, healthy, functioning, mother of three, working. I worked as a physio, doing everything. And the next thing, I mean, well, you know, the slippery slope, I suffer from severe depression. So I just want to say how, you know, this was just great for me to hear somebody say, yes, there is a link between the two of them. And also, just for anybody else out there who does think about, you know, their bones, and if they can take the HRT, I would take it. I would take a lorry load of it in the morning if I could get it, because my mother-in-law, who was a very thin person who really watched her diet, didn't take much fat in her diet because she was always very health conscious. And a bit like your Auntie Maureen, she ended up dying almost because of the pain. The radiologist said she had more calcification in her aorta than she had in her spine. So if she lifted, she used to make jam, a few pots of jam, she would have a fracture. She was just full of fractures and full of pain, and that's what made her take to the bed. And like you, I would just say to anybody, you know, I mean, I have had physical health issues this last year, so I haven't been able to walk, but normally I would have been a very active person. I have a low-grade lactose intolerance, so I can't really take, you know, milk, yogurts, that kind of thing. But anyway, just to say, but you know, and the exercise, can't do heavy lifting because I have a bit of a prolapse, and that would make that worse. Can't try not to lift anything heavy because of that. So I hope I'm not boring you all with this story, but I just want to thank you so much for bringing it all to light. And I would love to get the, you know, your slides, Maureen. Is it Maureen?
Could you take my email down, Deirdre?
I took your email down. Yeah, I found that very interesting because my sister as well, I said to her one day, go and get a DEXA scan. Her GP said to her, oh no, not at all. You do a lot of walking, you're fine. But she had lost a lot of weight, 5'9". She was like 10 stone. I said, go and get a DEXA scan. severe osteoporosis, and she's on the injections now at this stage. So,
and Deirdre, I'll just interrupt. You know, the research shows that even the tiniest amount of estrogen, like a patch that's 37.5, is enough to give protection to the bones. It's the smallest amount of estrogen. So it is always worth
yeah, well, I would love to take that if I could get it prescribed, because my mother has it, my sister has it, and you know, the HRT literally brought me, you know, brought my bones back from the dead nearly, you know.
Yeah, and it's always worth going to a menopause specialist. I mean, both Karen and I go to a menopause specialist.
That's I'm in Donegal now. That's in Dublin. I already have, you know.
Yeah, well, a lot of them are online.
You can see them. Yeah, you can see them virtually.
And they're the people that have all the research, all the experience. You know, the GPs are brilliant, but you know, they are general practitioners at the end of the day, and even gynecologists, obstetricians, you know what I mean?
Yeah.
And so in that respect, I wouldn't give up, Deirdre. I wouldn't give up.
No, I'm not going to, especially after that talk this evening now. No, I do not want to go down that road, and those patches sound great. So I really appreciate this talk, and from the depression point of view, I definitely associate when I started the menopause at 37, all of a sudden my mood just changed, and again, you know, just sort of went from bad to worse, and no family history of anything. 2 older sisters didn't start the menopause, and my mother till they were in their 50s, no problems. But as somebody said to me once, well, you know, and you can think of this, Karen, you know, you have to set yourself apart, really, don't you, from the ordinary person, and go and get those really bad things that are going to set you apart. But they just seem to all come at once. And I often thought of it, but nobody ever really said, well, you know, apart from the link between the osteoporosis and the menopause, because I would say my ovaries were packing, and before I was 37, I was already losing estrogen. And, you know, but from the depression point of view as well, I just find that very, very interesting, because I had no symptoms of depression until the menopause started. And boy, then did I, you know.
And Deirdre, I mean, that's what, you know, between my own personal experience and then here, that's exactly what I started to notice. Hang on a minute. There's a lot of people here being referred from GPs for depression and, you know, like new onset. So, yeah. So look, Deirdre, thank you very much. I have a question.
Oh, sugar. Where did I go?
Oh, yeah.
Yeah.
Right. Sorry, I hope it didn't take up your time, but I'm
no, not at all. There's a question
enthralled with what you were saying, your talks. Yeah, just amazing.
Thank you, Deirdre. Thank you. So, dear Catherine says that she doesn't have too many menopausal symptoms. Should I consider taking HRT for my bones, heart, etc.? Well, HRT, all the evidence, the body identical HRT nowadays, which is the patch, the gel, the Utrogestin, the little tablet that you can take orally or vaginally at night time, the micronized progesterone and the testosterone, is all body identical. So much, much safer, much lower risks of no risk of blood clot at all, and much smaller risk with breast cancer as well. None actually in the first 5 years of taking it. Certainly all the research, it's proven like it helps strengthen the bones. You have a 60% decreased risk of cardiovascular disease, which is, by the way, the second biggest killer of women post-menopausally. Alzheimer's is the first. Also as well, HRT protects against dementia. Dr. Mosconi over in New York is doing a huge amount of research into that, which is great. Type 2 diabetes, bowel cancer. So yeah, it's one of the main reasons that I personally take HRT. One of my main goals is I want to be 85 and in the gym and teaching yoga. my joke is I'll be wheeling my husband over in his wheelchair because he's on. And I'll park him into the cafe, and then I'll go upstairs with all my friends. I see Sheila there, and I see Louise, and I'll be teaching yoga.
Yeah,
It'll be great.
fantastic.
And they'll all be with me because they'll be on HRT as well.
Thank you very much, Maureen, for that
You'll be
answer.
living your best life, Maureen.
Yeah.
Thank you very much, Maureen, for that.
You're welcome.
I just wanted
to
to
jump in,
acknowledge.
that's okay.
Sorry, was someone
Sorry,
going to ask a
Karen.
question?
Yeah, Karen, it's Joan. I wanted
Oh,
to
hi.
jump in. A couple of
Hi.
people, and you yourself spoke about the fact that, you know, sometimes it's a lonely journey. I've been at all of these talks, and you and I have discussed it in the studio. And the one thing I have to say is that it's been so much easier for me because of you people talking about it. So thank you. Thank you so
Aw,
much.
You're welcome, John.
Thank
Welcome.
you.
That's great to hear. That's great.
Hi,
I just
can I
wanted
ask a
to.
quick question?
Oh yeah. Go,
Hi,
Rona.
yes.
Hi, Rona.
Yeah, hi. I'm great, thanks. Thank you, girls. That was very informative. I really, really enjoyed it.
Great.
My question is that I took bioidentical hormones when I started my menopause, which was 12 years ago. And I would say that the biggest side effect I had of being perimenopause and menopausal was anxiety. Now, I've never taken any HRT. I do take Vagifen, the tiny little vagina capsule things, but I'm now very worried that, you know, I did the wrong thing, because you're sort of saying that the bioidentical hormone creams, that they're not sort of licensed or registered or recognized as being a viable treatment for menopause. Now, I don't suffer with osteoporosis, at least I don't think I do.
Yeah, no, don't worry, Rona, about, no, you won't be poisoned or anything. But what's happening with these, I know a lady who gets hers from the States, and she spends $1,000 every 2 months. So the main thing is that they're unregulated, they're compounded in a pharmacy, so you don't know exactly what you're getting. So now, you know, I think the worst I've ever heard about them is that they don't do anything. That's
Okay.
Yeah, and then some people have good effects as well, but they're heavily marketed and very expensive and not regulated. So that's the piece.
So is it too late then to sort of even go down to exploring the route of getting HRT?
No, it's never too late.
But even though I don't have any more symptoms.
Yeah, it's never too late. What happens, so the best time to take HRT is the 10 years within menopause. And on that women's health study, that was the one good thing that came out. After that time, then, the chances are that you might have plaques in your arteries. The arteries are hardening a little bit. And if you take high dose of estrogen, it loosens up those plaques, and therefore there's a risk then of stroke or some cardiac event. But what they do is you can have an angiogram, or if you don't have any cardiac problems, start off in very low dose, like 25 milligrams, 1 pump of estrogen, or the 25 milligrams patch of estrogen, see how you go, and then slowly up. I know a lady who was 70 last week who started HRT, and because she was getting up during the night to go to the loo loads, anxiety, couldn't sleep, and still had hot flushes. So the key there, Rona, would be to go to a menopause specialist, really.
Okay.
That's what I would really recommend. Most GPs are still not up to speed, because again, they're general practitioners. And also be careful as well. I had somebody in work come to me a couple of weeks ago, absolutely in tears. She had gone to a menopause specialist, somebody who was advertising themselves as a menopause specialist in Dublin, a GP, North Dublin here, and they were anything but a menopause specialist, but charged. She ended up spending €400 in total for nothing. Didn't even get. Yeah, so it's becoming big business now.
Yeah.
So just keep it simple, keep to the space.
And is it something that a blood test will show up, say, if your testosterone levels weren't right, or if you were depleted in, say, estrogen? Is that the first port of call, is you're getting a blood test?
No, it's all about clinical symptoms. They'll do bloods to check your thyroid, your iron, everything like that. But I think, Rona, you could be pretty darn sure that your estrogen level, that all your hormone levels will be pretty low, you know. Yeah, because of your age. I can't see your age exactly on Zoom. But
well, I'm 62.
Oh, okay. Yeah, perfect. So it'd be worth then going to menopause specialists. There's a menopause hub and Quiva Hartley, and there's a few more now. Deirdre Ford is really good. Yeah.
Okay.
So if you want to email, I can. There's a list actually. The Irish Menopause Facebook group have. They update it all the time with. I checked to see if this bogus menopause, she wasn't on it. No.
Yeah. And is it a myth that if you start on HRT that eventually you have to come off it? So you're just putting
yeah,
off.
that's a myth. Yeah. That's a myth.
It is a myth. Okay. Because people say if you
there's-
go on HRT, you're only postponing suffering all those symptoms. But
No, like if you took thyroxine, would you go off thyroxine? Or some doctors have said, oh, the women are feeling too good, I'm taking them off HRT. What? That doesn't make sense.
Yeah.
Oh, no. Oh, that's another thing I intend, Rhoda. I intend to be in the coffin with my patch on me. I'm not even going to let them take the patch off me, my Testigel in my hands.
yeah, ready to go.
And I'm going to be 115.
Yeah, no point in going down with the preserved body. Just go with all the therapies. Yeah. Okay, thanks a million. And thanks a lot, girls. It's been very informative.
Right,
A bit scary, but informative.
Thank you.
Brilliant.
Thank you. Yeah, just call me, Rona, or email me, or more than happy.
I will. Thank you.
Great. Anybody else got any questions burning in the back of their heads that they wanted to kind of ask about? Just check if there's any down here.
No.
Yeah.
Lots of people saying thank you, Deirdre.
Yeah, Deirdre, for
Thank you.
Hi, sorry, it's Elaine here.
Hi, Lane.
Hi, Lane.
Hi, thank you both very much. It was very, very informative, and I think very encouraging to kind of get moving, to take action. You know, it's a subject that I think it's beginning to be talked about, but hasn't been talked about a lot in the last few years. So thank you very much. I was just wondering, is there a particular time of the month that that you should get the blood test done to check your hormone levels? You know, is that, you know, or can you just go at any particular time of the month to check your hormone levels?
Well, if you're for progesterone levels, you have to, it's written on the blood form there is a certain time. If you're under the NICE guidelines, if you're under 45, you can do bloods to indicate the follicle stimulating hormone levels and the luteinizing hormone levels. Over 45, the blood levels, the blood tests are too unreliable. But it's really even under 45 as well. It's about that clinical, the clinical symptoms as well for the woman. Yeah. So, yeah, so it's really probably, you know, for the testosterone or for the progesterone, I can't remember what it is, it says it on the blood form, but it's the estrogen they'll be looking at anyway, and then the testosterone and the sex hormone binding globulin.
They'll look at those ones, see where you're at with those.
So there's no particular time of the month, you know, like mid-cycle or end cycle or anything like that, that you should maybe organize your blood test for?
No, because they, like, if you do know your cycle, you know, some women don't know, but with their cycle they could be going like, you know, 60 days without a period, and then they will have. But if you are regular, then, you know, they'll ask you the date of your last period, and then they'll know where you are in that cycle, whether it's, you know, the follicular or the luteinizing.
Okay. Yeah. Oh no, I get it. Yeah.
Yeah, but it's not a biochemistry diagnosis. So it's more about that clinical piece, and also that piece around, I want to protect my bones, I want to protect my heart. Yeah. And then if you go on Louise Newson's website or the Balance app, there's a checklist. So sometimes people go, no, I'm fine, I have no symptoms at all. Next thing, oh my goodness, I do have dry eyes, I have itchy skin, oh, my hair's falling. oh, I have this uncontrollable rage. I thought I just,
It's all those really kind of arbitrary symptoms, the ones that I spoke about initially, that like sinus infections, you know. Actually, I was actually talking to someone today who suffers with sinus infections, and funny enough, she's perimenopausal, and she had run out of her patches, and you know, she was kind of feeling the drop in them. That's fantastic. Catherine has just said that she has downloaded the Balance app. Woo!
Catherine, fabulous.
There's some
Excellent.
great reading in that, actually. It's brilliant.
Knowledge is power.
Thank you.
Thanks Elaine. I also want to acknowledge Anna's comment up here. I know Anna, and I'm delighted to hear Anna's had a hip, I can't find her here now, but she's had a hip replacement a few years ago. She's stage 4 osteoporosis. So this has prompted her now to inquire about HRT with the link that's there. So that's brilliant. Fantastic, Anna. Get yourself. The problem with these specialists is that they've got.
Thanks, Karen.
Hey,
you're welcome. You're welcome.
I'm
But,
absolutely shocked.
Are you? Yeah.
Completely flummoxed. I cannot believe this, because everybody has. I go to see a specialist for osteoporosis, and he told me he thinks it's genetic. There's been, I have not got one trace of estrogen in my body, apparently. I've just had my bloods done. And nobody has said anything to me about this.
Yeah.
And you guys now have linked it, so I've got to see somebody as soon as possible, you know?
Yeah. See, the problem with this, unfortunately, is that there's no joined up talking between these specialists. So when you are, you know, when you are presenting with symptoms, like, you know, I was referred to an ENT specialist who took one look at me and he was like, "What's wrong with you?" And then goes, "Well, I'll send you for a CT scan anyway." That was one thing I didn't mention. So I had the CT scan, of course, it was normal. And then he said, "I'll send you to a respiratory consultant." And at that point, I was just like, no, do you know what? I've spent enough money on this lark. So, you know, you can forget about that. So, you know, nobody makes the link really between one thing and another, which I think it's a crying shame, because apart from the cost that you go down to, you know, going to see various different specialists, it's the distress that you feel yourself, because you're like, I know there's something wrong with me, but I just can't put my hand on it. You know?
Yeah, or we would get a lot of women in here with a diagnosis of fibromyalgia. So
there's Joe with the hand up, I knew it.
Yeah, when you look through the history as well, and it's like, you know, there's more. So
Sorry, just when I was a younger physio, like in the early 80s for Dovo, and I don't think osteoporosis was even recognised by the WHO until 1983 or 4, whatever. But I was a young, fit, slim, young physio, and I used to have, you know, a lot of women coming in of menopausal age, and they'd come in today with a sore back, and the next day they come in and they'd say they have a sore shoulder, and the next day they come in, it would be their neck that would be sore. And I used to be thinking, and you know, I was totally ignorant of you know, there being any kind of a link, and I was thinking, like, more or less, what are they going to come in with next? And what about, and we'd be chatting, but what about these women coming in of this age with all these things? And now it just, you know, it makes such sense, but nobody you know, made the link, but they suffered with their pains, and you know, it was terrible.
Yeah.
And probably still do, because as I said, my GP there, the GP my sister went to a few years ago in her early 60s, the GP downright refused to, and she'd be very fine boned, to send her for a DEXA scan. And because, oh, you walk a lot, you've no need to go for a DEXA scan. I said, Aunt, just go organise it yourself, go and get it done. And she had severe osteoporosis. You know, so the other thing that I have to say, as a physio, it amazes me the number of educated women out there, all sorts of women who don't know about osteoporosis. A neighbour of mine she's a microbiologist, one day, whatever we're talking about, I said to her, do you ever have a DEXA scan? Because I thought her bones looked very fine. Do you ever have a DEXA scan? Do you ever think, you know, about osteoporosis? What? What is it? What is it? I have no pain. And I said, I think you should have a DEXA scan. Severe osteoporosis. And she had known nothing about it. You know, and this is, I think this is a big problem, that it's lack of awareness. Like, women just don't seem to know about it.
No. So Deirdre, thank you so much. We're going to finish up now.
So I just want to say thank you for everyone for joining us, and thank you for your lovely comments and for your input as well. Just so you know, we send out this recording. I'll also ask for Maureen's, because I have a lot of your email addresses, so I'll ask for Maureen's presentation and I'll include that. And then the other little piece of information that I'm going to include is a link on some research that Leah Bryan's actually, who couldn't make it tonight, because she's also a physio and a Pilates teacher. She's teaching tonight. So she sent a link with some research that's done on how Pilates improves your bone health. It's recent research, so that would be worth looking at as well. If for Pilates in particular, because it does have the resistance with the springs. So some light reading for you all, and you have Maureen's email address as well if there's anything mental health wise you wanted just to kind of ask, or burning question. But yeah, we'll leave it at that. Thank you so much, ladies, and enjoy the rest of your evening.
And Sheila, thanks so much for your help with the presentation.
Yes, thanks, Sheila, and
thank you
to all
fabulous ladies. Thank you so much.
You're welcome, and to all my lovely ladies, the clients who've joined me. I will see you on Reformer very soon.